Dr. Carol Clark. I'm a sex therapist and an educator for the International Institute of Clinical Sexology and the Sex Therapy Training Institute. And in sex therapy, we use something called the PLISSIT model, P-L-I-S-S-I-T. And this was created by Jack Annon, A-N-N-O-N, back in the 70s. And this is something that can be used not just by therapists, but by coaches, educators, physical therapists, anybody that's been trained in human sexuality and is working with clients or patients and want to give limited information and specific suggestions to deal with sexual problems that may arise with their clients and patients. So the PLISSIT model starts with permission, P being permission, and a permission statement I like to use uses the active listening response. You sound and you insert an emotion, and then you put in what the issue is and go a little bit deeper, not just reflecting. So for instance, you sound really concerned, you sound upset, you sound frightened, you sound angry because your partner wants to have sex more frequently than you do, because you think you're not attractive to your partner because they don't want to have sex with you, because you haven't been able to orgasm the way you want to, because you haven't been able to orgasm at all, and you think there's something wrong with you. So a response like that shows that I'm paying attention, that I'm getting it, that the person has come to the right place, and that I'm going to be able to help them because I'm really listening to them and I have some insight into what's going on for them. Limited information is just that, limited information. And you want to tell the client something they don't know. So we're not repeating something they do know. If someone comes in and says, I'm having problems having an orgasm with my partner. I'm a woman, my partner's a man, and I would like to be able to orgasm through him putting his penis in my vagina, but I'm not able to do that. And I'm really concerned because I'm supposed to be able to have an orgasm with my partner's penis, aren't I? And now a permission statement might be, you sound really concerned that there might be something wrong with you because you're not able to have an orgasm through penile-vaginal penetration. And they're going to say, yeah. And I'll say, a piece of limited information is, it's really hard for women to have orgasms through penile-vaginal penetration because the easiest way for a woman to orgasm is with direct stimulation of her clitoris. And the clitoris is outside of the vagina. The clitoris is really difficult to stimulate through just the penis going straight into the vagina. So one of the ways, and here's where we get into specific suggestion, very specific suggestion for what they can do after they leave your office. Specific suggestion is there's different positions that you and your partner can use so that your clitoris gets stimulated while the penis is in your vagina. And you can do that using manual stimulation with putting a hand, your hand, his hand between your legs. You can do it with changing positions so that your male partner is behind you. And then you can manually, or with a vibrator, or with something else to stimulate the clitoris. You can do it with you, the woman, being on top instead of being underneath the male partner. And so with the man on top, or the woman on top, then you have more access to stimulate the clitoris with a hand or with a vibrator. And there's also a position called coital alignment technique where the woman, are laying on your back, the man is on top of you, and with his penis inside you, but both your legs are straight, and you engage in a gentle rocking motion rather than a thrusting motion. so that he can have his penis up against your clitoris and just rock gently to stimulate your clitoris rather than the thrusting that would probably miss the clitoris altogether. So there's your specific suggestion for that particular person that comes into your office. IT is intensive therapy. Very few people need that for a simple problem like the example I just used. But a lot of times people do need intensive therapy because there's an underlying issue going on that has to do with trauma, that has to do with self-esteem, it has to do with how the partners are connecting or communicating. And there might be some past trauma that between the partners or a trauma that they're bringing into the relationship. So there's a lot of other things that can be going on that do require therapy. But in a lot of simple instances, the PLISSIT model, the PLISS, really do the trick. You give a permission statement, so let the person know you're in the right place, and it's okay to talk about whatever you want to talk about. Limited information. Here's some information about what you've just shared with me. And a specific suggestion is what I'm sending you home with to do homework, because any work we do in my office falls more under the intensive therapy. The specific suggestion is here. Go home, do this, and then you can let me know how that works out. So that's the PLISSIT. Thank you.